first I want to just thank the National Sleep Foundation, as well as Health 2.0, the team here for making this all happen, because without them it doesn't happen. So thank you. Poor sleep is a problem, because poor sleep leads to a progression and a medical condition. We heard that talked about the other day. It suppresses the immune system, and when the immune system is suppressed, all sorts of bad things happen in the body, leading to acceleration of diabetes, hypertension, and other activities. More research is going to be coming up on the issues of sleep and the sleep problems in the next 5 years. And what we need to do is we need to figure out how to make, as we all heard earlier, it's not just nutrition, it's not just fitness, it's also sleep. We need to make sleep more relevant in terms of people's health and treatment, and that's what we're focusing on at Serenium. There are 500 million people who have sleep disordered breathing in the US and China alone. 500 million people who have basically a medical condition that's going to lead to the progression of these other diseases, higher costs, and obviously pain and suffering for those people. What Serenium is doing is developing a platform to deliver and to access large populations of people, to get them screened, to provide wearables and sensors, analyze the data, and give them actionable information based on clinically valid solutions. We screen people with online screening programs that are standard, that are used by physicians, along with demographics and clinical information. We then provide various innovative wearables, like this being the breath meter, which is a product used in Europe for measuring sleep as a home sleep test, but it has some differentiation, which I'll talk about a little bit later in terms of its sensitivity and being able to be used in children. And excitingly, we also have biomarkers that will be used for the identification of sleep issues. Think a pregnancy test, pee on a stick kind of product that will allow us to access that 500 million people who really need to get tested early so that they can get into this process, the screening process, to identify their sleep issues. The information coming off of our wearables and our sensors are then provided back to the patient, and the patient then can share that information with his or her doctor with clinically relevant information. We also provide other support to doctors so that they can then take that and provide appropriate treatment or monitoring for those patients. So that's what Serenium is about. We're about being the world's best respiratory and screening company for both adults and children tend not to have as many products and services in this arena. We're focusing on this preventive health, getting to these 500 million people in just those two countries alone early to slow the progression of the chronic disease. It is not just about testing people who have hypertension or other chronic diseases and seeing how they can improve their sleep. It's about that 90% of the pie that's not getting touched that we need to touch earlier and quicker. We're building our activities on clinically superior testing being approved by the US FDA and the Chinese FDA, medically validated solutions, and our products are differentiated. We have the luxury of having people on our team who are very high up in the clinical arena, members of the American Thoracic Society and other groups who see, as I say, see everything out there in the market, and we are partnering with groups to bring differentiated, sensitive products to the market to support consumers and primary care doctors directly. Okay, so it's a portfolio of solutions. It's not just one solution to identify these diseases, and this enables us to have this population health risk assessment that can be used. And if you think about where glucose testing was 25 years ago, we need to get sleep testing to be in 5 years to where glucose testing was and it is now. So our system focuses on both consumers and primary care doctors. It was mentioned earlier that primary care doctors are important, and they are incredibly important. In places like China, with the hospitals, the big giant Chinese hospitals have sleep beds for only 12 patients a night. You cannot take care of the problem of identification if you cannot move it out of the hospital That's important, and you then also need to get primary care doctors involved in this decision-making process. They need to know what to do, and they need to be given information in an actionable format. Our breath meter product is a product, as I said, that's out of Europe, that's being used in Europe, that's been submitted to the FDA. It has these two magnets that get used, attached to the forehead, and measures mandibular motion, which mimics and reflects breathing issues with esophageal pressure. We have it right now in the FDA. It is showing 92% correlation with the gold standard PSG. It will have a very attractive price point, which will also allow us in the future to go out with a pure consumer play at a low price point and a very favorable, easy-to-use product. The magnets that measure also provide differentiation because of the sensitivity that allows it to be used in children. So this will be a home sleep test that's very sensitive to pick up low AHIs and RDIs, which are just measures that doctors use to understand what your apnea situation is. And it also is a validated solution that is strongly supported by clinical research done in both the US, Europe, China, and in Brazil. Our biomarkers, which we're very excited about, is like a pregnancy test. So this can be showing up on a shelf at Walgreens in the future, or CVS, or somewhere else in Asia, where consumers can help drive back to their doctors the need to get their OSA, their sleep apnea, tested. This is going to be a huge advancement for the field. It's being compared to PSG. This product will be out in 2 years, and this is where we are really going to be able to impact those 500 million people in those two countries and really change the identification and the treatment of these sleep issues. Okay, so what Serenium is about this preventive health approach with clinically validated solutions, differentiated sensitive offerings, and with a portfolio of solutions that we look to add other products into this portfolio, some of the great work that many of you are doing, and what we see this leading to is really consumer screening for everyone. If you have questions, find me later. Thank you very much.